Hello, everyone. A very good afternoon, and I'm very, very happy to have again one of the high achievers for the NEET Super Specialty exam held in January 2022. So, I would like you all to meet Dr. Asha Rani. And hello, Asha. Heartiest congratulations. And
Hello,
she
ma'am.
secured a score of 272 in the NEET SS exam. And that's great, Asha. And I'm really, really proud of you. And how do you feel right now?
Thank you so much, ma'am. And like it was due to constant support and positive support from you all. So, like I feel good because last year my rank was 500 and plus, and
Okay,
this time, yeah, I was able to achieve uh, at this level.
great. This is absolutely amazing. And I've known Asha personally for last 3, 4 months, and I've seen, despite being a postgraduate in Obs and Gynae, which is a very, very hectic branch, I've seen her really work very hard. And, she's been constantly studying, and it's never an easy journey. So, Asha, I would like you to tell us about your dream to become a super specialist and how did you think of pursuing it? And when did you sort of decide to join us as dams, because we recently started with the NEET SS program this year itself and we've had some very good results. And could you just tell us something about your journey, from when you finished your post graduation to starting your preparation for your super specialty exam?
Yes, ma'am. I have done my MS from TNMC Nair Hospital, Mumbai, and
That's
I have
wonderful.
done my bond from KM Hospital in Mumbai. So during the OPDs, we had seen patients who were cancer patients, and
Right,
we used to do nothing about them. We just used to refer to those patients. We used to just take the biopsy and we used to just refer those patients. So
right.
some of those patients were like they were like around perimenopausal age or around
Yes,
around 40 years of age. So it was very disturbing for them and it was very shocking for them as well when they used to know about that they have this cancer and they didn't knew about it. Some were
yes,
stage 4A. So
right.
so that was the thing that just came to my mind, that I do not want to refer these patients. I want to treat these patients.
That
So
is
from
so nice.
yes, ma'am. So from that time, during PG period, because the residency was very hectic during
I
my time, it was
understand.
very hectic. So I was not able to study at all, and I
Yeah.
studied for my postgraduate exam just in the PL. So after that, during the bond time, I decided, like I was a like it was very late, but still I was like, yeah, I have to prepare for that. So after 6 months of bond, then I started, and then I uh, looked out for the material, and then I started preparing for the same.
And that is a very, very inspiring, Asha. And I think your desire to do something more for these cancer patients is what has led you to enter the super specialty. So I think it's a dream come true, and it's not just a happy thing for you, but I think the patients need doctors like you who really want to, go ahead and go an extra mile and do what they can best for their patients. So that is really, really heartwarming and very inspiring, Asha.
Thank you, ma'am.
And Asha, now let us talk a little about the curriculum, bacha, hai na? So when we talk about NEET SS exams, the ratio is about 30/70. Yes. And
40, 60, 40. It was earlier.
okay,
It was
40/60. So 40 general and 60 specialty.
yes, ma'am.
And, we had launched an MCQ based program, Asha, as you know. So could you tell us
Yes.
something about how did you use it and how do you think, it helped you in paving a path for you to prepare?
Yes, ma'am. For the paper, part A is 40, which is journal OBGY, which, as I
Right.
told you, in my postgraduate period, I had no time to read. So
That's
that
right.
was, I think, the weak part for me when I analyzed my previous attempt.
Yes.
And part B was 60 marks question, which was earlier it was separate reproductive medicine and gynecology, but last
Yes.
year they clubbed it.
Yes.
So yeah, so for oncology, I had read Beric and Hackers, and for reproductive medicine, Kamini Rao. And but my part A was still weak, so I was trying to work on that part. And meanwhile, your course has also come at that time, because the notification has come that the new pattern will come and everything will
Yes.
be on the PG exit level.
That's
So
right.
that is when your course had come, and I was looking forward to it, to focus on those, on especially part A, which was
I
journal
understand.
OBGY, where, because there are certain areas that are not so tough, because but we tend to ignore it. But
True.
I mean, we do not focus on that part because we are not aware, okay, that this is important. Because what is important for this exam is, they touch every area.
That's
The
true.
paper setter, they touch every area. You need to know what is important. That is what we have to study and revise again and again. Okay. So for that mainly, so it was a good thing, because at that time, time was very less, and yours was a MCQ based course. So that
Right.
was the good and smart thing, because that is how it could have been covered. And I also am, as I have told you, uh, I'm a Damsonian. I have already attended your classes during my PG preparation. We were the first satellite batch you had conducted.
Oh,
So,
that's that's
so I,
that's
I
so
already, I
that's so
had,
nostalgic, to have your
yes, ma'am.
MBBS graduates now reaching to these heights and seeing you as super specialist, as I said, is really, really heartwarming for us because, this is the best reward for a teacher when you see their students shining. I mean, there is no better gift than this. So it's great to know that you were a Damsonian from undergraduation times to now postgrad and super speciality as well. So you really, really made us proud.
Yes, ma'am. So that is how it has played a role, because part A, where your journal OBGY you have to do, so you need to know those important areas. So
Right.
those were very well covered by your NEETSS course, ma'am.
Great. And now, Asha, can you tell us something about the difficulty level of the paper and what kind of questions are asked? Some of the important topics that you would want to tell about that, are very important for the NEET SS Gynae Oncology course.
Yes, ma'am. Actually, the thing is that we have already sorted out for the part A part for the students. Those are the only things which is important. I can, oncology, like I have prepared from Beric and Hacker. So all the cancers, the five important cancers, they are very important. The
Yes.
pre-invasive lesion thing, that is the pre-invasive lesions of cervix, vulva, vagina, that is also very important. So many
Yes.
questions are asked also in AIMS, and I said so many questions are asked from that pre-invasive lesions chapter.
That's true.
Uh,
And that
and
is why, Asha, that is why when we started with the NEET SS course, the initial few classes were
Yes, ma'am.
dedicated on oncology and infertility and endocrinology
Yes,
because
ma'am.
they
Yes,
constitute the major chunk as well. So we
yes,
thought of
ma'am.
covering these things first so that, you are covering the more bulky part initially and then you gradually work on the basic and the general part as well.
Very well said, man, because you had pointed out the important areas and important topics which we have to do. In oncology, as I said, pre-invasive lesion is a very important chapter. AIMS, they
Right.
love this chapter. They ask so many questions from this. And again, CA vulva, CA vagina, we think that these are not important, but for examiners, these things are very important. They ask like
Yes,
everything. Yes, they ask all the important things from these.
that's true.
Pre-invasive lesion, all the five CAs, including CA vulva, they are asking so many questions from CA vulva every year in every
Yes,
exam. Yes, ma'am. And there are certain topics, like if you do the recalls, you get to know, for example, CIN, verrucous carcinoma. There are some topics which are like repeatedly they are asking in every
yes,
exam, 6 monthly or 1 yearly, like that. In infertility, the endocrinology you had covered very well. So that is the important thing that we have to keep in mind. Um, and in OBGYN, they ask everything. Like they will ask in AIMS also, even bacterial vaginosis discharge question that has
yes.
also come, fibroid questions had come,
Yes,
adenomyosis question had come.
endometriosis,
Yes, ma'am.
exactly. We had
And in,
questions on RH negative.
yes,
I
ma'am.
think that is something that she's pointing out very well because although they say that the distribution is 40/70, but she is very right that they have almost asked at least one question from sort of every topic.
Yes,
And
ma'am.
it was a very good mix of some basic level MCQs and some high level MCQs as well.
It is like everything, like moderate level also they ask, and high level they
Yes,
also ask, and
yes,
some also like mild question they also put. Every year they ask about dysgerminoma, the markers and all, but they
yes.
also will take their level and ask something else. So like everything they are asking. And infertility, basically all those topic, PCOS, endometriosis, as you
Yes.
already told, those are important. Guidelines for these exams are important. Like we need to
Yes.
know the guidelines. Yes, ma'am. And for OBGY also, the ACOG guidelines are there, so that is important. If somebody have already read Williams, then that is a plus point for them.
Yes, and Asha, especially when we also started the theory courses for MS candidate students as well. So people who are pursuing their MS, we had this year started the theory and the practical course as well, and we had made special attention on the most recent ACOG and RCOG guidelines. The
Yes,
green top
ma'am. That is
guidelines, and
important. Yes, ma'am. So that is
yes.
important. They ask from the guidelines directly.
And I think, Asha, I would really want to ask you that from what I could gather from the paper is that you need to have a good content. I mean, you have to have a very strong content when you appear for these exams. Although it is an MCQ exam, but I think content is the major role here because it's only 100 MCQs. The time is sufficient, so time management is not a problem. It is basically about how well you know your content. What is your idea on that?
I'm here absolutely correct for that. That has took me like 6 months of more preparation because I had not covered that content. So my rank was not good in the first attempt. So I took my time, and you have to like, because this is a NEET SS exam and the seats are very less in
Yes,
gynecology. That is the problem, because
yes,
in any other branch you see there are so many seats, and here
I know.
even someone who is getting a rank of 40 or 50 is not sure that he or she will be getting a government seat,
I
especially.
agree. I agree.
So
That is why
that
the
is, yes, ma'am.
competition is
So the
very, very
competition
strong.
is very high, and if you have seen the cutoff of gynec oncology is 250, which is very
Yes,
high out of
yes,
400.
yes.
So you like we have to do that, and if somebody is smart enough to do it in a less time and focus it on important areas, then nothing is good than that.
Yes,
So
I
covering
think
the
she's
content
very
is
right
definitely
because
important.
otherwise the course is very vast. Imagine
Yes,
something that
ma'am.
you took 3 years in your post graduation to read, and now you have to sort of cover it up in a span of 2 to 3 months. It has to be selective study, but yet in depth. So we have to know
Yes,
what
ma'am.
is the relevant areas where we need to put our energy, and that is how we as teachers are trying to help. I agree, the hard work is all yours. It's a lot of effort, it's a lot of dedication, but I think working on the right path is what gives you the extra edge.
Yes, that is very important because everybody now after their post graduation, 99% of the people they are working, and
Yes,
like
true.
we, it is not about after MBBS that you sit leaving everything. 99% of them are working, so it is very important to know which areas are important, and to also have a knowledge about the previous year's questions, because that gives an idea like where you stand, what you have to study, and on what topics you have to focus on.
So this is what we have planned for the upcoming NEET SS exam, Asha. And this time in the course, we are going to soon add multiple videos now, where we would cover the questions asked in the INISS as well as NEET SS, and we'll build more content on it. I think that would be
Yes, ma'am.
the add-on for the upcoming June exams. Is that a good idea, Asha?
Very good idea, ma'am.
Great, great. So we would love to have contribution from you. And Asha, anything else? If somebody asks you, beta, that what is the time required to prepare for the NEET SS exam? When should they ideally start? For example, now the exam is scheduled in June, month of June, as of now. Although they keep changing the dates, so we can't be sure. But I think starting now is a good idea. So 3 4 months agar aapko mil jate hain, that should help you to accelerate for the exam. What is your idea on that?
Yes, ma'am. Actually, the thing is that, ma'am, if somebody is looking for the top rank, for from 1 to 5. So to be honest, since it is a club, like everything is clubbed now. For other
Yes,
branches, it might have changed, but for our branch, it is same. Like we have to study everything. We have to study
everything.
obs, gynae, reproductive medicine,
Yes,
oncology. Because if you are excellent in one and if you are mediocre in the other, that will definitely is going to take your rank or your score back. So it is
yes,
like you have to keep a balance. You need some time, but on the top of that, the most important thing is that focus is very important than the number of hours you put in. So that is what, even if in a day you get 3 or 4 hours, but you are highly focused, so that is your yield is going to be very higher as compared to somebody is putting 6 hours. uh,
True.
studying in a passive way. So nowadays, like previously, what I think is we were not aware because gynec oncology branch is recently, like it is recently separated. Earlier,
Yes.
it was like oncology only. From that
Yes.
surgical oncology, people used to take this. So
Yes.
this is, and everybody in Obs Gynae is now want to do something super speciality at level. So everybody is now starting, like in their
Right.
postgrad level, everybody is starting. So that is a good thing because people are aware of that. And I do not have time in my postgrad because it was so heavy to think of anything else except my residency. So everybody is starting from the postgrad level, which is a very good thing because slowly, steadily, we because we are in a tertiary care hospital, so
Hmm.
difficult cases and all sort of cases come to you. So
Yes.
meanwhile, you can study it with the recent guidelines. Like even if you're in the labor day duty, then something high risk eclampsia patient or any IHCP patient comes. So you can just go through the ACOG or RCOG guidelines. So that is how even the postgrad people can simultaneously prepare for it. And after that, you need some like 1 or 2 months, depending on the depending on how much focused you are. So if you are able to give that time, then like time is not an issue. You can directly give because mostly freshers are also clearing it. You do
That's,
not
I
need a
think that's a
separate
very,
time.
that's a very, very wise piece of advice. And she's given a very genuine advice that it is not necessary that you need to drop a year and then exclusively study for it. I think she's very rightly saying how to balance while you are studying. And if you are consistent during your postgrad, ensure that you're doing the content nicely, and you don't have to sit and do it once in a go. So as she
Yes,
says, you
ma'am.
see a case, usko padho, refer to the guidelines, and side by side karne se things become a little easier. And then in the end, last 2 months, maybe a dedicated study
Yes, ma'am.
is what is going to help
That
you.
is fine.
That is very,
Because
very
the yes, ma'am. The
apt
major
advice.
difference is that ki now now people know. Now every post grad they want to pursue something. They want to do something. Now MS Obs Gynae is not an end branch. Everyone wants to do something. So this is the because people are aware and they are ready to do it. So this is the correct strategy, and they need not to drop to get a rank in NEET SS now.
Yes. So this was a very, very enlightening interview, Asha, and I congratulate you once again on on your rank and how you have performed. And I think you're really inspired by students like you, and wish you a very, very bright future ahead, Asha. So thank you once again, Bache. And anything that you would want to say towards the end, motivating to people who want to appear for the June exams, something that you want to say to them?
Yes, ma'am. First of all, a few lines about you. I had joined Instagram too, and I had followed the Dams family. So, if you are preparing for an entrance exam, and the first thing that is important is to stay motivated, and we get demotivated,
That's
because I
true.
have been troubling you.
No,
So
you haven't troubled me at all. Please don't say
we
that. My students never trouble me. In fact, I think, Asha, whatever I know and I keep learning, a lot of it comes from the students only. So when you ask me something, I get a push ki, Are, mujhe bhi padna, I have to continue studying. I have to go through the guidelines. You are the reason why we also put extra efforts into what we are doing. So it's not a trouble. It's a very, very mutual relationship. And I'm very thankful to students like you who have faith in us. And actually, you inspire us to work even harder. That is what I
So
would say.
your yes, ma'am. So your podcast and your the thoughts they are like that you post on Instagram. They are really important because everyone every single day might get demotivated, but all those
Yes.
things they keep on going us. So please keep doing that, ma'am.
I will. I'll try my best.
Yes, ma'am.
Great. So we congratulate Asha once again. So all the best, Baches. Stay connected to DAMS, and thank you for
Definitely, ma'am.
making us a part of your journey.
Thank you so much, ma'am.
Bye bye. Take care.
Bye, ma'am.